you could have type 2 diabetes and not even know it. But before you're diagnosed, your body sends out warning signs. Your skin is one of the first places they show up. Stick around until the end because we'll reveal 12 crucial skin signs, as well as share expert tips for protecting your skin and preventing serious complications. Many people discover their diabetes too late, so share this video. You could literally save lives. Did you know that you could have type 2 diabetes and not even know it? According to the American Diabetes Association, ADA, type 2 diabetes develops most frequently in middle-aged and older adults, but it's increasingly affecting younger people as well. In this condition, the body doesn't use insulin properly, a phenomenon known as insulin resistance. At the early stages, beta cells in the pancreas produce extra insulin to compensate. However, over time, the pancreas can't keep up and it fails to produce enough insulin to maintain normal blood sugar levels. The numbers are staggering. Each year, 1.2 million Americans are diagnosed with diabetes, and about 37.3 million already have it. As you can see, this is a national epidemic. You can find more statistical data on the ADA's website, diabetes.org/treatment for type 2 diabetes, includes physical exercise and a healthy diet. Instead of ultra-processed foods, stick to real, whole foods. Eggs, avocados, apples, strawberries, teas, and nuts are 1,000 times better than any so-called diet bars you find in grocery stores. But before you're officially diagnosed, your body sends warning signs, and your skin, the largest organ of your body, is one of the first places these signs appear. However, we shouldn't ignore other parts of the body either. If your skin is changing color, thickening, developing blisters, or forming wounds that won't heal, be careful. This could be a sign that your blood sugar is out of control. Sure, anyone can have skin issues, but people with diabetes are at a much higher risk. This includes bacterial infections, fungal infections, and persistent itching. The worst part, many people discover they have diabetes too late. Today, we're going to discuss 12 skin signs that indicate you need to manage your diabetes better, or that you may have insulin resistance. Stay until the end, because in addition to these 12 signs, we'll also give you some tips on how to take care of your skin and prevent serious complications. Don't forget to share this video. This information could help many people, or even save lives. Subscribe to the channel, hit the like button, and turn on notifications. But remember, it's very important to see your doctor regularly, especially if you've noticed any of these symptoms. If you have persistent skin issues, consult a dermatologist. Alongside your doctor, take charge of your overall health. This is your responsibility and shouldn't be delegated to anyone else. Now, let's get into today's topic. Who can experience these skin symptoms? People with insulin resistance or type 2 diabetes. The problem is that many don't even suspect they have diabetes. They only realize something is wrong when their skin starts changing. So, pay close attention. If you notice any of these signs, seek medical advice. And if you know someone who might have them, share this video with them. Now, let's go over these warning signs. 1. Yellowish, reddish, or brown skin patches. Necrobiosis, lipoidica. These start as small bumps that look like pimples, but over time, they turn into hard, shiny patches. They are most common on the legs and don't usually hurt, but they are a strong warning sign of uncontrolled diabetes. You need to manage your blood sugar more strictly. Velvety patches on the neck, armpits, or groin. Acanthosis nigricans. These dark, thickened, velvety textured patches appear on the neck, armpits, and groin, indicating insulin resistance or even pre-diabetes. If you notice this, see a doctor and monitor your blood sugar levels. 3. Thickened, hardened skin. Digital sclerosis. Your skin becomes stiff, thick, and hard, almost like calluses. This happens on the fingers, hands, feet, sometimes even on the face and chest. If left unchecked, it can spread to your joints, making it difficult to bend your fingers. Blood sugar control and physical therapy can help maintain mobility. 4. Blisters on the skin. Diabetic hornbula. These are giant blisters that appear on the feet, legs, hands, and forearms, making it look like your skin has been burned. They're painless but can get infected. If you notice them, see a doctor immediately. And remember, never pop these blisters. 5. Frequent skin infections. Fungal and bacterial infections can appear anywhere on the body, but they're most common between fingers, on nails, and on the scalp. Symptoms include itching, redness, peeling, and even pus. If this is your case, control your blood sugar and maintain strict hygiene. 6. Wounds and ulcers that won't heal. These are sores that just won't close, mainly affecting the feet. Check your feet daily, and if you notice any wounds, see a doctor immediately. There's a high risk of amputation if left untreated. We're halfway through the video. Have you seen any of these signs before? Do you, or someone you know, have any of them? Comment below, and while you're at it, subscribe and turn on notifications so you don't miss videos like this. Remember, diabetes doesn't give warnings before it strikes. Let's move on to the next signs. 7. Brownish spots on the shins. Diabetic dermopathy. These small, dark spots resemble scars and appear on the legs, arms, and thighs. They're not dangerous, but they indicate circulation problems caused by diabetes. 8. Red and yellow bumps. Eruptive xanthomatosis. These are small bumps that look like pimples, but turn yellow over time. They appear on the buttocks, elbows, and knees, signaling that your blood has dangerously high fat levels. 9. Red or skin-colored lumps. Granuloma annular. These show up as small lumps forming rings on the skin, usually on the arms, hands, feet, and legs. They may disappear on their own, but they indicate uncontrolled diabetes. And once again, never pop these lumps. 10. Extremely dry skin and intense itching caused by dehydration. These signs indicate circulation problems and infections. The solution: stay well hydrated and use specific moisturizers. 11. Yellowish patches around the eyes. Xanthelasma. These are fatty deposits under the skin and are a sign of both uncontrolled diabetes and high cholesterol. 12. Numerous small skin growths. Skin tags. These tiny hanging bits of skin may be linked to excess insulin in the body and could be a sign of diabetes. If you've noticed any of these skin symptoms, start checking your blood sugar levels regularly. Prevent complications by keeping your diabetes under control. People with high glucose levels tend to have dry skin and a weaker ability to fight off harmful bacteria. Both conditions increase the risk of infections. Don't ignore these warning signs. Seeing a doctor is the smartest choice you can make. So, comment below and share this video. This will help many people who need more information on this topic. By subscribing now, you'll get exclusive videos on health prevention tips and alerts that could even save your life. Don't miss this chance. Subscribe and turn on notifications so you never miss an update. And that wraps up today's video. We hope you've learned something new and useful. Thanks for watching, and see you next time.